Hi there. My name is Sebastian Baumgaertel, and I am an orthodontist in the Cleveland, Ohio area and a clinical associate professor at Case Western Reserve University. It's a huge honor that our article got selected by the American Journal of Orthodontics for their video of the month for December 2020. And while I still encourage you to read the entire publication, I'd like to use this opportunity to discuss a few of the more salient points of our paper. Our article is titled 10 Years of Miniscrew Use in a U.S. Orthodontic Residency Program, and essentially it represents a 10-year audit of the results achieved in our Skeletal Anchorage Clinic, which is a program dedicated to the use of orthodontic miniscrews. Initially, our residents underwent both theoretical and practical training, and then after passing an exam, they were allowed to use miniscrews on their patients as they saw fit under my supervision. For analysis purposes, we looked at the influence of insertion sites and the influence of biomechanics on the outcome of the miniscrew use. And we split the insertion sites into 4 different areas. We split it into the anterior palate, the posterior alveolar process of the palate, and then the maxillary and the mandibular buccal alveolar process. And what we found was that the overall success rate was roughly 73%, which is okay, but certainly on the lower end of what is published in the orthodontic literature. Now we need to keep in mind that our residents were beginners at using miniscrews, but more importantly, if we look at the numbers a little closer, we realize there was a statistically significant difference between palatal insertions and buccal insertions. And my residents fell victim to the beginner's bias. The beginner's bias is a tendency for beginners to place TADs in the buccal alveolar process rather than in the palate where miniscrews are more successful. When it comes to biomechanics, we also found that indirect anchorage was a lot more successful than direct anchorage. However, there's a caveat here. Most palatal TADs were used with indirect anchorage, and so it is hard to say that it was really the biomechanical setup that boosted the success rates rather than the insertion site in the palate. Either way, though, I think the findings of this paper are really encouraging, especially for clinicians, because they show that even beginners can use miniscrews successfully, particularly if they use the palate. I hope this was useful for you, and if you have any questions, don't hesitate to contact me. You know, I love to talk about miniscrews. Thanks for watching.